All right, so we just we've done a lot about cesarean section. All right, a lot about cesarean section. So right now it's just all about trying to talk about the different types of ways they can actually incise. Incise is basically like cut your stomach literally to access the baby. So this one we are focusing on what is known as the Pfannenstiel incision. Pfannenstiel, all right. The P is silent, okay. Pfannenstiel incision. So if you look at several incisions here, but you see the Pfannenstiel incision is the most commonly done for cesarean section, where they just cut the woman down here. And note that the cutting is not straight, they kind of like curve it. There's a reason why they curve it. Do you understand? We'll talk about all of that. So it's also known as the Kerr incision or the bikini line. Bikini line because if you are wearing a bikini, this is where the top of that bikini will go along. Do you understand? So that's just the basis for it. So there's also transverse abdominal surgical incision. It's made just above the pubic symphysis. Okay, so it's widely used in gynecology, widely used in obstetrics, all right, for urological surgeries, especially cesarean section. So we're not saying this is used for only cesarean section. No, it can be used for other conditions too. So for what we got, key features is horizontal, is slightly curved, just like I told you guys, slightly curved, about 2 to 3 centimeters above the pubic bone. Length is typically 10 to 12 centimeters if you measure the whole length of that. Cosmetic advantage, that's why they make it curve, is because of what the cosmetic advantage. Like later on now, when the wound of that incision is healing up, all right, there will be little scar. Do you understand? So the scar will be hidden by pubic hair, or there's like minimal distortion. Yeah. So muscle involvement may require separation or transection of the rectus abdominis muscle, depending on the exposure needs. Okay. So common uses, cesarean delivery is the most common way that will make them incise a woman like this. But you can also have pelvic surgeries, like if they want to do hysterectomy, remove your uterus, they can still go that way. If they want to operate on your bladder, they can still go that way. All right. If they want to repair your pelvis, okay, in orthopedics, they can still go that way. Then surgeries on your prostate, surgeries on the ureters, anything that have to do with the urinary system, you can still access the urinary system via the Pfannenstiel incision. Limitations, is not ideal for oncologic surgeries, any surgery that have to do with cancer, all right, because the opening is not that wide, so there's limited access. Do you understand? If I want to go on a cancer, I'll open it this wide. Do you understand? That's a midline vertical incision. So the different types of incisions a healthcare provider might want to opt in for depends on what they want to access. You understand? So Pfannenstiel is not suitable for everything. Okay, so there's risks of blood vessel injury if the surgeon is not equipped with the anatomy knowledge of that region. Now it requires careful hemostasis to prevent hematoma or infection. As they are doing the surgery, they are supposed to be blocking the blood vessels. All right, you'll be hearing some sparks like during surgery that are blocking the blood vessels. So the surgeon should always block those blood vessels, because you want to prevent all those too much blood loss and risks of infections. So that is what a Pfannenstiel incision is.